She'll have to advance it herself. I could go grab the advancer actually. Oh man. Yeah. Okay. You're welcome to sit at the actual table as well if you want. Should be, yeah. So what they're gonna see instead of you, actually, probably to your relief, is just gonna be your screen.
Hear your voice.
Yeah. So you'll have to advance it here, and then the mic is not as good as it is in there, but I'll probably unmute it now.
Oh, that's really good. Crazy noisy thing.
No, I didn't.
I made a sound. I was playing with it. I forgot to take it out. Yeah.
Oh no.
It says things like.
Oh, there we go. There we go.
How'd you know how to do all this? Well, I should have called you to make me. I had it all planned. I was going to use it. I took the time to do it. I thought they would enjoy next plan. Yeah. Now I know how to do it, and I got the plan. So I thought they would enjoy the time. Just go ahead. We could ask.
Not necessarily, no. I can try to drag a table once you guys start.
I think it'd be helpful for interaction.
Hi, Deborah. Can you hear us? Great, thank you.
Brought a sample, fill out paperwork, and get their fecal sample in the courses. Everybody good advancing there? Oh, this guy? Okay.
So I'm not going to do anything else I can solve.
Yeah.
Yeah. I mean, if there's an emergency, it's a real fun.
No. Okay. Yeah. Make the speed faster. Yeah. No. Should we start at 7?
You give it like a minute or two.
For sure. Do my best.
You know,
Last questions.
Yes.
Participation. That's good. Thank you for doing it.
Some of the
People I know are probably harassed. They always like to say should be in this. Danielle and Mary. Man.
And what is the parasite group involved with the AUP? Is it group? I mean, you have to do the white paper and stuff like that.
Infectious diseases. And then when they develop and get the vector borne next year, but that's just part of it. That's just they don't have parasites.
Tonight's lacrosse night.
So Pennsylvania.
Yes, you know, starting to even out.
That's true. They're good.
Yeah.
Yeah, that was good team. I guess so. I've been here 10 years. Yeah, right. We had, I think 15 out there practicing. From Peter's 12. Yeah, it happens. Can't do anything back. That's right. I said finally decided. I think
Okay. Okay. Yeah.
press the button.
All right.
So what do I don't push anything.
Well, if you want to advance the slide, you
No,
can
but
push
other
next.
It's started. It's already. Don't say anything back.
All right.
So are you gonna say something?
Yeah, I'll say something. Well, welcome everybody. Thanks for coming again. Our spring is finally coming, right? We're having some nicer weather. Thanks for tolerating our changes. We were surprised by students writing an exam in a room that we thought we were going to give a presentation in this evening. So thanks for bearing with us and having some comfy chairs this evening. So I'd like to introduce Dr. Linda Mittel to you. She works in our diagnostic laboratory and she's a gem. She's one of our veterinary veterinary support services. So we call them the VSS group. And they do a lot of coordinating with veterinarians that call into the hospital and say, hey, we have this problem on a farm. And they're like, oh, what kind of clinical signs are you seeing? They help them kind of triage or figure out what test to submit. And then when the samples come here, they actually will follow through, make sure that everything's going okay, and keep communicating with your veterinarian on kind of what's going on there. So they're really great liaison between the diagnostic lab and the veterinarians out in the field working with you and your horses. So, but on top of that, Linda's an expert on parasites as well, and has helped with the American Association of Equine Practitioners write up the white paper on parasite management in horses. More recently, ectoparasites, so parasites on the outside that make you itch. And I think she has some fun stuff and was key to getting these free fecal samples in for you guys tonight. So, so thanks for doing that. And we look forward to hearing about you and the parasites.
Yes, okay. Well, thank you guys again for coming. And I actually like this room. It's a little bit more personable. So I think it's nice and the seats are more comfortable. As Dr. Perkins said, I am in the diagnostic lab, but prior to this was a practitioner in the most recent area I lived in was Connecticut, but I lived right on the border. So I could practice in New York and Connecticut. And then I have practiced when I started in Kentucky and Alabama and North Carolina and Florida, Arkansas, and Texas. So everybody teases that you move from place to place because nobody wants you to stay. Well, that's not true. I left because I was getting other interest, other opportunities, and then I ended up in the New England area because of the husband, or soon-to-be husband. I met him at the Derby, and so it ended up that I became, as I tell everybody, a misplaced Southerner up here in Yankeeville. However, as I look back, my husband's family was from Alabama, well, Athens, Georgia, rather, and my family's from Kentucky. And so really there was a Southern connection before we even knew each other. So my son is now in Kentucky, so I've got him down there, so that's good, training him right away. So anyway, with all that, I ended up, after practicing a very long time doing horses only, I saw this opportunity in one of our journals, and I thought this would be interesting because I did have training as a parasitology. I got my master's in public health at University of North Carolina, and then actually decided that this would be a great opportunity. So the people at the lab that are VSS all have practical experience. We all practice in the field so that we understand that what your veterinarian's going through when they're trying to be on time, when they're late, when they're trying to get a sample from a bad horse, all these things. So when they get on the phone and say, we couldn't do this or we need help, we really understand because we've all done that before. So part of our responsibilities at the diagnostic lab is to offer CE and help out because we feel that education will help keep the horses healthy, because if you guys are controlling the horses, basically you understand that they'll be better off. So tonight we did bring some supporting materials because we have that ability. There are some little tick pullers, which I'm not going to speak about ticks. I know you all might want to. You're welcome to ask questions later, but I didn't get into that part of it. And then we also have some little keychains and little tchotchkes, as I say. And we are doing the free fecals for a certain number of people. If you're interested, I don't know if you brought your samples, but that was part of the circumstances. We have some little tubes of different types of ticks that are being seen. And that jar over there, I'll open it up later if people are interested. And we were talking about the small Strongyles, and we have a piece of tissue that actually was affected in a horse that died, and we had over at the diagnostic lab for necropsy. So we have a lot of little things to help you, and we also are working with the veterinarian in the field to be able to try and help them be able to offer to you guys at a limited, less expensive price, I should say, or a less regular price, to do a fecal, what we'll talk about, I'll mention it to you, so that you can actually tell if your horse has any resistance or the potential for a resistance pact. I also wanted to introduce to you Dr. Manny Lejeune, who's sitting there. He is the director of the parasitology lab at the Animal Health Diagnostics Center, and he identifies unique parasites. His staff will do the fecals, and we have a very talented, I should say Danielle here is actually one of the members of the team, and Pixie was a former member because she's gotten lucky and retired. So we have a very strong parasitology lab. A lot of the big laboratories in the United States do not have a true parasitologist. He's boarded in parasitology. So as he says, if he doesn't know, he has a lot of friends that are all common parasitologists, and they put their heads together and they can come up with some identification of some things that maybe have never been identified. So that's one of the things we have as a real strong asset to the diagnostic lab. But anyway, my thought here tonight was to try to tell you guys about something exciting and interesting. But then I decided that's not what I should do, because what I would like to show you is all the creepy crawlies. But that's really, you all would sit there and like it, but then I don't feel like I taught you what you need to know. This is spring. This is the time you really need to think about what you need to do with deworming your horses. We can maybe do the gory things another time, maybe in the middle of the winter or something. But right now, I felt obligated to teach you guys or explain to you about what we need to do with deworming. So that's what we're going to do. If it's boring and you fall asleep, I understand. I won't mind. It's late at night. Let's see what it is. If it shocks you here. Okay. Everybody always wonders why you give the history of a parasite or history of anything. And the reason is that you learn from the history on what to do or what not to do. And so what I wanted to explain to you, we have to change our deworming programs, how we deworm horses. I know everybody sees them in the Horseman and the Western horse and the horse and all these things, but it's confusing to me. I can be honest with you. So I think it can be a little confusing to people who have to deworm their horses and don't always understand exactly why. So I'll do my best to explain it to you, and hopefully if we have any questions, we can discuss it if we have the time. But the history about these parasites is why we do things a certain way, and that's what I want to tell you about a little bit, and then we'll do some additional sample testing. I didn't mean to put that in there. Okay, first of all, a lot of you guys know what a large Strongyles is. If you don't, those are some of the parasites that when we first started learning about parasites, and I mean, we knew parasites existed a long time ago, but when we really started being able to kill them and deworm horses was about 50 to 60 years ago. And what happened down in Kentucky in particular, there were some problems with the parasites because they have a lot of horses. And they ended up, oh no. And they ended up having a lot of people doing research at the University of Kentucky, and they became very well known as one of the top universities doing research on parasites, and dewormers, and life cycles, and all those things. So what they did is they found out one of the reasons they had these serious colics and problems with their horses in Lexington and other places in the United States, but that's where they started. Now this picture here, probably to an uneducated eye, when I mean that like a non-veterinarian's eye, might be confusing. But what this is the inside of an artery. This artery is a major artery that feeds the major part of the large colon and large intestine of the horse. The inside should be nice and smooth and slick. But what happens, this parasite, and it's a young parasite, it's not an adult, it sets up housekeeping in this part of the vessel, and it causes irritation, and it causes little blood clots, and it's still immature, it's not mature yet. And what happens is these little pieces, when the blood is flowing through, will break loose, and they'll actually go downstream and clog a vessel. If you've ever heard of people having a clot and they break loose, they will often cause what they call pulmonary emboli, and they could actually die from it. Well, the horses don't specifically die for the same reason, but these little pieces actually can be released. They go downstream and they plug some of the blood vessels that feed the intestine. So you can imagine if there's something plugged. I mean, people get blood clots in their legs and their legs hurt really bad, like the worst cramp you've ever seen. So these horses would get little colics. And when I say little, They'd give them the old medication that they used to give. Doc might know over there. Doc Lowe might medication. Dr. Lowe knows.
Find one without one of those.
Huh?
I say you couldn't find a horse in the post-mortem
Without
without
those.
some evidence of that.
Absolutely. So it was a terrible parasite. And what would happen is that if a bigger piece broke off and it took off downstream and it would block a major part of the bowel, the horse would colic and be in excruciating pain. And we were still learning about surgery. So we'd maybe try surgery. We'd go in and we'd take out a big section. But a lot of times it was too big and we couldn't do it. So the horse had to be put down. So what they did down in Kentucky is they learned the life cycle and they tried to find products to kill these worms so that they wouldn't have this problem. So they did. They developed what we call, they had a TBZ, which is not used routinely in the horse world, but it was a parasite or anthelmintic or dewormer that would kill the adults, not these little guys. These are immature, as I told you. They have a little cycle I'll tell you about later. They would go ahead and it would kill the adults. And they thought they were doing really well, getting rid of these adults, and the horses did get better. There weren't as many colics, as many problems. And as time went on, they were under control, and they made a recommendation that they would deworm their horses about every 6 to 8 weeks approximately. And that's because it would take from the time the horse took the parasite in its, or the larvae in its mouth to the time it was an adult was about 6 to 8 weeks. So they figured if they dewormed them every 6 to 8 weeks, they would kill all the parasites and there'd never be any out there. They also saw another little parasite called a small Strongyles, and they're like, they're not pathogenic. They really don't cause any trouble. So they put all their efforts into this particular parasite. And what did they do? They minimized it. We did not have very many of these large Strongyles being seen. I don't think I've seen but 2 or heard 2 on the floor from necropsy since I've been here, which is about 10 years. So as Dr. Lowe said, every horse that came in, even if they didn't come in for colic or some problem, if they looked, they had damage to this particular vessel. So what we did is we patterned all our deworming by this plan, all over the world, or United States, I should say, not the world, maybe European countries. But we went ahead and realized deworm your horse every 6 to 8 weeks. How many people do you all deworm your horse that frequently now? I won't say anything to you if you do. Okay. Even if you don't, you do it maybe 4 to 5 times a year. So maybe do you really need to do that? That's the question. So what ended up happening as time went on, we kept on monitoring, doing this for the last 40 years. We wormed their horses. When I first had my horse, I wormed it every 6 to 8 weeks because the farrier would come, and when he was there, I'd worm the horse because that way I could remember. Otherwise, I'd forget. But that was part of it. But that isn't the way to deal with it now. We found out the hard way that this isn't what we need to do. So the history is horse people are very traditional. They like to do things very traditionally. We like our saddles, our colors. Of course, now some of them are pink, leopard. But the thing is it's a traditional sport. However, now what we've recognized, there's 3 parasites in the United States. Do you know if this is true? There's 3 parasites that I'm worried about in the United States. Are those the 3? Does anybody know? We have the cyanthostomes, which is confusing, which is the name, the sophisticated name for the small Strongyles, the cyanthostome. Everybody knows that there's tapeworms, right? Tapeworms. And then we have the Parascaris, which is the fancy name for the roundworm, or aspirid that some people call it. So do we see these 3 in the United States at this time? All 3 of them? Often? Frequently? All right. The fact is, it is a fact. Okay? It is true that we do have this as a problem. In a small Strongyles, when they were doing the work, they did see the small Strongyles at first, but they didn't think it caused any trouble. But what this little guy did, and I always say some parasites are smart, I just use that term, this little parasite became resistant because it was in the intestine along with all the other large Strongyles. So it developed a gene that made it resistant to many of the dewormers that we use. And this is a fecal ball with the actual parasites on there. Now that can occur in a healthy horse when things are coming, when they pass through. But if you have a horse that's sick and colicky and looking poorly perhaps, this may be the real reason. If you see this, that you may have that problem. We've got a lot of larvae, or parasites rather, adults coming through the feces. These are also called bloodworms, not because they got blood in them, but because of the color. So these guys are resistant to our dewormers. Okay, just to kind of give you a real quick synopsis of the life cycle. Life cycles to some people are really boring. They don't want to hear about it. But bottom line is, if you know a little bit about the life cycle, you know where you can break it and maybe help the animal. You know where you can stop it and make it happen to prevent it from causing disease. So first of all, if we start where there's eggs, let's say there's an adult, it's producing eggs, they come out in the feces, and they are on the ground in your pasture somewhere, and they develop into what they call, or it hatches, I should say, and it develops into a little thing called a larvae 1. That's just the first one, and they're tiny, really tiny. And then it grows just a smidge, and it's a larvae 2, and then it moves and develops into a larvae 3. Now this little larvae has a little coat on, it's ensheathed, it's like a raincoat, so to speak, and it protects it from dehydrating too much, and it keeps it from being too dry. So it likes to be in a little bit of a moist area because that's just the way they're made. Now I'll explain something else later that we found, but in essence, they will come and crawl up and down the tops of the grass, and then when your horse chomps on them, they take those in, it goes through their mouth, goes through their stomach, the acid doesn't hurt them, and this EL means encysted. It goes in, and in parts of the intestine, it actually encysts, and I'll show you a picture of that, and that's actually what's over in that one jar. It'll stay in that encysted area. It's like a little bubble. And while it's in there, it develops. But you can imagine if it goes into the intestine, it drills a little hole in, bites a little hole in, and it stays in there. And it can stay up to 2 years, maybe 2.5 years. There's been few reports of 3 years, but 2.5 years without doing anything. It's just sitting there. And then it will, under certain circumstances, it'll develop from the developing L4 into your adult. You go back into the intestine. This is actually in the tissue of the intestine. The adult comes out, and it's in the inside. It's hanging out where the manure is and other things. And there, the male and the female breed, and the eggs are produced. So then the whole cycle starts all over. So where can we break this cycle to prevent this from happening? That's part of the reason, if you understand the life cycle, you know what's going on. But bottom line again is that this adult, from the time the eggs are produced to become an adult, is considered the life cycle. And it takes on the order of about 5.5 to 6 weeks. So we've already got a little different time frame than what we did on the large Strongyles, but they're all very similar because they're in the same family. Now this is a picture, maybe not as clear as I'd like, but this is what the intestine of a horse looks like that's got small Strongyles that are encysted. This is just to give you an idea of these circles, of how many there can be. And this is actually a close-up of what they look like. Now, even though this sounds pretty crazy, it is somewhat crazy, they feel in a large pasture, and when I say large, maybe like an acre, there can be over 2 or 3 billion parasites in that pasture. Because the eggs are produced pretty highly, they have large numbers of eggs, and if those little larvae develop, that they can be in a little drop of water, which I'll show you in another slide, a little bit of dew on a grass strip, there can be up to 100 to 1,000 in a drop of water. So you know if the horse is grazing, you turn him out right now, it's springtime, the weather's nice, these parasites are starting to come back. They don't die over the winter, you can slow them down, but they can actually come and survive, and your horse will start eating the grass where these parasites might be. And they can take in, if you know how they graze, if they haven't been out, all winter, they won't lift their head, that they'll be grazing all the hay, every grass they possibly can find. And if there's parasites on it, you can imagine how many they can take in. So the small Strongyles is normal in many horses. It's not that bad, but when they have large numbers and they keep having problems with taking more in, there can be a problem. So anyway, that's the fact on that. I don't know why I did that. Anyway, just to kind of let you know, large Strongyles is kind of what we started out with. It's big, but it's not caused by the damage of how big they are. They cause damage because they migrate through the body, and they cause issues in the artery. As I told you, they're migrating. The small Strongyles, even though they're little, they also cause trouble because they encysted, as I told you before. They make a little hole, And when they grow up to be the L4, they're bigger. So the hole they produce coming out is even larger. Okay, now this is leaving the Strongyles for the time being. But remember, the Strongyle is the problem we're dealing with that is most critical, okay? We talk about all the things we need to do. The main thing we need to do is do something about the Strongyle. All right, tapeworms, gory as everyone likes. Tapeworms are a problem in all horses, but not horrible problem. You don't need to get really upset about them. You do need to deworm on a routine basis for them, and I'll mention that. But they don't usually cause the problems that you see with the Strongyles. This is an area, they like to live in a certain area where they call it the ileocecal area, which is where the small intestine gets ready to move over into the large intestine. There's where the cecum is. And they have this interest of hanging out there, and how they know these things, I've never figured out. But I do believe they're learning that certain parasites have a propensity to certain, what they call receptors in the body, and they go there. Well, that particular tube that goes into the cecum can vary in size to the size of a horse, of course. Like with a draft horse, it might be this wide, and if it ends up getting full of parasites, fluid and water and things can't go through. So it backs up, causes a lot of pain, and actually can be like it can actually cause a rupture if it gets tremendous, but generally it doesn't do that. The other thing that it does is it causes intussusception. Does anybody know what intussusception is? That's where the telescope's back on itself. The tissue goes back onto itself because the motility is messed up. They think that something these parasites do change the motility by damaging possibly the nerves of this area. So the intussusception occurs, which means nothing can come and go. And the tissues, if they stick together, they will die and they have to be cut out. So they're not minor, but hopefully you don't get to those points. But what else happens with these guys is they can leave little tiny holes, and they seem to cause an enteritis or an inflammation, particularly in baby horses, foals. So it isn't a horrible parasite, but it is a parasite we need to pay attention to. There are certain parts of the United States that do not have this parasite. So if you know where you live and you're sure that this area doesn't have them, then you don't have to deworm. But most of the horse areas in this part of the country do have parasite. There is a map that'll give you the percentages, but I always worry if they're up to date. And the fact that your horses are moving, they go to horse shows, different areas, they may be born in Florida and they end up in New York, or they may be born out west and they end up here. So you need to be sure that when you do a fecal, you'll see if they're present, but they're not always present, because they don't produce eggs in the same manner as the other ones. So even if you get a negative fecal, people are recommending that you deworm your horse against Strongyles, because against tapeworms, because if you don't see the egg, it doesn't mean that it's there. There have been some other tests, they try to test blood. None of them have become really that good. So the only thing you can do is assume if you're in the area that you do need to deworm with product that will get your tapeworms. Okay, this one here is a bad one for young horses. This is Parascaris, or the roundworms. It's an absolutely life-threatening situation with baby horses. This is the egg, and there are little variations in the way they look, but that's a generally one. It's not a big egg. It's bigger than some of the others, but it's not that big. Basically, that is a tough egg. That egg can survive for very long times in the winter, in northern Canada, lots of places. So it's very, very hardy. And it's been known, and there may be other studies, but I was always told it could last almost 20 years in a pasture where there had been that before. Now, whether or not it's all true these days, but it basically lives a long time. So if you have a farm that has baby horses, foals on it, and there's eggs there, and then you decided to put your farm there with foals, you could pick them up from that particular farm, or from the previous people that had been there in the farm. They will go ahead and actually be able to infect the foals. But the problem is these parasites, when they grow, they become up to 12 inches long. They look like spaghetti, which is kind of gross. But when they actually get big, they often tangle up, and then they can't move through. They're like a ball of yarn or something. And this is a picture in surgery of a young foal that they tried to do surgery on to try to help, and they found this, and it had damaged parts of the intestine. That is a large number of parasites, but it does occur. So if you don't deworm your baby the right way and they develop to this stage, you can really have life-threatening circumstances with your babies. Okay, so how are we going to get ahead of this parasite? How are we going to take care of all the parasites, but mostly the Strongyles? Because that's the one that's really going to give us trouble. Anybody have any ideas besides looking here? What do you all do? What do? You just say, my horse, I haven't wormed him, in 2 months I'm going to worm him again.
Well, maybe just like keeping your pastures from overgrazing, because they're gonna pick up more parasites if the pasture is overgrazed and there's barely any grass anywhere.
Right? Real good idea. That's the management part, absolutely. Overgrazing, stocking too many horses on a small area. Of course, a lot of people can't do anything about it if they don't have any more land. But that is an addition, but if you want to kind of figure out what you need to do, you need some data. Just like everything else, you got to have some facts. And the only way you can tell what parasite is in your adult horse or in your foal is to do what we call a fecal egg count. And that is where you have to take a sample. And that's what we talked about tonight. If you brought it, we can actually have them done in Dr. Lejeune's lab. And they have a special procedure where we do 3 grams of the manure and set it up, test it, count it, and then do a little bit of a calculation. We can tell you approximately how many eggs are in so many grams of feces, and you can get ideas. None of this is 100% detailed because you're still trying to figure out how they know how to do this, but they've done a lot of research and they've shown that horses that have more than 500 eggs in the 3 grams that they test or they calculate, they have more worms. Doesn't necessarily mean they're proportional, but they have more worms. So they have guidelines. This other thing called the fecal egg reduction count, I guess I can move to that. So I forgot to tell you here, the fecal egg count, it helps count the eggs. It can monitor the numbers that are there. It might, in not every case, it depends on the procedure, they can tell you if there's like a tapeworm that happens to show up. There are some procedures where they don't do that, they just do the counts. So wherever you send it or wherever your veterinarian sends it, they need to know if they do a certain procedure that will identify the worms as well as give the counts. Because if they're only counting for Strongyles, you will never know if indeed there's an aspirate in the foal or if there is actually a different parasite. So that's one of the things you may want to ask. And it assists you in determining the shedding levels. And what that means is we can determine how many eggs that your horse tends to shed on a natural basis. That'll help you figure out how to handle it. This fecal egg count reduction test, actually just a bunch of letters that tells you how efficient the deworming is. And it'll help if there's a resistance. You can tell if your product that you're worming with, your chemical that you're worming with is working or not working. And all you basically do is you take a sample before you deworm your horse. And if you worm the horse within 8 to 12 weeks, you should be sure you're at least 8 to 12 weeks after the time when you dewormed it. Then take your sample, handle the sample correctly, do your fecal egg count, have someone check it for you, and then 10 to 14 days later, you retake another sample and you compare it with a little formula on what was there before and after. And you can tell whether your dewormer was working. There's a little, as I say, a calculation. If it's at a certain number, and there's no reason to memorize all this because it's all written down, it'll tell you whether the product that you use is getting a resistance. And if so, what's the use of deworming with it if it doesn't work? It's a waste of time. The other thing it's doing, it's making the animal more resistant of the parasite, not the animal. Okay, so here is the picture I was telling you. This is a dewdrop on a piece of grass. And these are all those little larvae. So you can see there's almost 100 in one drop of water on the grass. So if your horse is eating all these, you can see how many larvae that he can actually take in. The term refugia to me is a little confusing. Does anybody know anything about refugia or refugia? Depends on how people want to say it. Anybody have goats and sheep? No? They've been ahead of the horse world for a while because they have a serious parasite problem. Because they have a parasite that's in the Strongyles family that sucks blood and the animals die very quickly if they have a heavy load. So they've been trying to figure out how to prevent this resistance for a while. And one of the ways it's called Refugia. It's a safe haven for parasites. Now what does that mean? It means that the parasite is not affected by the worm or wherever it is. So as I mentioned to you before, there are certain dewormers that you actually deworm for the intestinal parasite that lives inside the intestine with manure and all those. And then there's some that live within the tissues and some that live in the artery. There are two different ones. One's mature and one's immature. So if you deworm your horse with a product that only gets the adults, the ones that are hanging out in the bow because they're immatures are in a safe haven. Now what difference does that mean? Why do you care? Well, once they are hatching, they'll go back into the intestine and be ready to pass through the manure. They haven't been subjected to all the chemicals and they don't develop the resistance. So what we want to have out on the field is a group of parasites that don't have the resistant gene because they haven't been stressed or hammered with the chemical. So part of the idea about this is you're trying to protect your pastures as much as you're trying to protect your horse. Matter of fact, probably more. Because if the pastures are clean and they don't have resistant parasites, chances are you won't have problems. But if you keep deworming, all of these little parasites out there on the field are going to be resistant. And when your horse eats them, keeps eating them, there's nothing you can do. So we want to promote Refugia by not deworming frequently like we did. We want to go ahead and deworm when we're supposed to, and we want to use the right products. So word to me, I always have a problem with it, but that's what it means, okay? So what are the consequences if you deworm too much, use the wrong product? You'll develop resistance and their genetic mutations. Parasites are pretty smart. They mutated so the parasite does not get killed by the wormer that you used. How they figured that out, I don't know. It didn't take that long. I mean, they do produce a lot of eggs and they breed a lot. And the more they breed, or more anything reproduces quicker, the chances of the mutation to occur is better. But it does not, this is the thing that I find fascinating, the large Strongyles has no resistances whatsoever. After all the years, 45 years, we kept deworming them, they do not have resistance. This little guy, after just 40 years, is resistant to a number of products, and we're finding that there's more resistance being developed on a routine basis for some of the products. So we want to try to use the right product. We don't want to use one that's resistant, and we don't want to keep using it and make something resistant. Okay, this is a little bit hard to read, but the whole idea was, is that over there on the paper, the FDA, the United States government, has now recognized that we have a very serious parasite problem in the United States. Even in Europe, but the United States is the FDA's with. They recently just put this piece of information out, and actually like a piece of paper over there explaining that actually shows this, that they know that we need to deworm our horses and our sheep and our goats a special way. There's recommendations on there. Don't use the wrong product. Do fecal exams to get the ideas. Work with your veterinarian. And they're going to put on the box, all of you know what the black box is on things like on cigarettes and alcohol. They have a little box where it's outlined in black, the black box. I think it's going to be something like that. I don't think it's going to be quite as prominent, but they're going to put something out that says, when you get your box on your dewormer, pay attention. This is really important because I don't know that you think about this, but if we lose the only dewormer that we have, which one is the most, what is one of the best wormers we have right now? Which one? Quest or Quest Plus, either one. Plus it's got the Parascaris, but Quest. If we use that one and it develops a resistance, that smart little Strongyles develops a resistance, we won't have anything to deworm our horses with. So if we get one that happens to get a heavy load, what are we going to do? Right now, there's no company, unless somebody is doing it in the background. And we've all been asking if the research is going on, that there's new dewormers being made, and there's not. So right now, if that happens, we have nothing. And if you've ever seen a wormy horse or a horse from colic, even those large Strongyles will come back. If everything's resistant, they'll just show up again. So I try to value the Boxidecta. I use it only on special cases and under certain circumstances. So I just want you to think about that. That's one of the things that we have to keep in mind, and the FDA recognizes this. They had a meeting in 2012 in Washington, and I went there and listened to all the specialists talk about it. They knew this was going on. Only took 6 years to get the paper out, but you know how it is. But they got it together, and they're recommending that all the drug companies put it on their box. So what I think about is that when you deworm your horse, you want it to have personalized care. Have you all heard that buzzword? Everybody talks about personalized care in human medicine. When you go, they want to ask you, does your family have this history? And do you have this history? And do you have this? They want to make a medication, or if you have cancer, they want to make it to help you, because there's some drugs that don't work with certain genetics of certain people. So they want to personalize the care to you. So they're not giving you medicine that doesn't work, or they don't give you medicine that make you really sick. Some people can't take certain medications. So what we're doing with the horse is almost the same. We're going to do personalized care for each of our horses when we're talking about deworming. We want to treat your horse safely, and we want to prevent resistance from occurring. Okay, now here are 3 little examples. If you test your horses, we test all 3 of these, let's say, and we get a fecal egg count. And we count, and first all the fecal says there's none or 200 eggs per gram after they do their little test, or they do 2 to 500 or greater than 500. This is how we categorize the people, or the horses, I should say, on the parasites. So on this thing, can you tell which one of these horses may have had a low, mid, or high? What do you think? This one is a little overweight, would you say? Just a little miniature? This little donkey looks pretty good, got a little fatty. This poor horse looks skinny. Which one looks like it's got a large number of parasites, or which would you guess might have a large number? Skinny horse? Okay. Any other ideas? Trick question. If you have a horrible case of parasites, this possibly could be the case. Quite honestly, this one had more parasites than any of them. Yeah, trick. The problem is that you cannot look at that horse and say, I will worm this horse with so-and-so, because this horse is heavy and fat and it doesn't have any worms. Or you can say, this one's dying. It may be dying, but it may be dying from cancer. It may not have anything to do with parasites. And then you give them all this parasite medication or dewormer, and it doesn't help. So you need to do fecal egg counts. There's no way you can get around it. So you need to work with your veterinarian to be able to get them to get the samples for you, or you get the samples and they can get them tested. The other thing that's really important that I want to mention to you is that the parascaris or the ascaris are associated with the age, the young animal. If you do not worm them the right way, a young animal, you will end up having serious problems. And what you want to do is you treat them as high shedders. Now, I didn't mention to you here that low, mid, and high shedders, we kind of have an average on how we do it. If it's a low shedder, we usually worm it twice a year if it's an adult. If it's a mid shedder, we may deworm it 3 times to 4 times a year, depending on circumstances. And if it's high, it may be 4 to 5. So we're trying to, when we talk these sheddings, it's not that the horses look bad. You can see this one looks fine, but she's producing large numbers of parasites on the pasture. She has so many eggs come out. She just is one of those horses. And it does not always affect the horses dramatically. They have their own immune system. Some of them will stay 0, and some of them will always stay this. And when you repeat them every year or you test them, they tend to stay in the same category. So if they're a low shedder, all their life, they usually are a low shedder. Same thing, high, they're always a high shedder. Does not indicate how healthy they are. It's just, that's what happens. And even though I know most people would like to have 0 parasites in their horse, it's gross, nobody likes parasites, but quite honestly, it's normal for horses to have some parasites, and you cannot hardly get rid of them 100%. The only way you could do it is if you take a horse, a foal, that probably has never had grass, maybe not even nursed, because you can get some parasites through the milk, but very rarely. You can go ahead and put them in a room and never let them have grass and never let them have any exposure. That might be the only way they would never be exposed. One of the things I always cringe about is you take your horse to the horse show and they're grazing all around the paddocks where all the other horses, who ever knows how they deworm those horses. And it is like, oh man, let's not let your horse graze, because you keep him nice and dewormed at your place, but he just took in millions when he was grazing while he was at the horse show. So what you do on the baby horses, you treat them as high shedders. Doesn't matter what they have, other than we got to plan on what product to use, is you do it 4 times a year at least, and some people recommend every 2 months. So you want to start baby horses at 2 months of age. Anybody have an idea why you would only start them at about 2 months of age? Any guesses?
Is it because if you deworm them too late, will that get impacted?
That's absolutely correct. No, they will. If you don't get them at a certain age, the worms will get to a certain size and impact them. Well, why don't we deworm them at 30 days of age? Any ideas?
Because their immune system won't be ready for it.
The worms won't be big enough. You're right. Good idea. Good idea. So the worms aren't big enough to actually be killed by the product. So you got to wait, because their life cycle hasn't allowed them to get to the intestine where you can actually kill them. There's 3 products that we use on baby horses for the roundworms, the bad ones: the fenbendazole and the paranopamoate. Fenbendazole is like Panacur or Safeguard, and paranopamoate is Strongyles. They only kill the adult parasite, the ascarid in the baby horse. Just as a point that people don't always think, and I just mentioned it, baby horses are not supposed to be given moxidectin. If you don't know that, some of them get away with it, but the way the product is made, it works through the fat in the body, and baby horses don't have much fat, and it crosses the blood-brain barrier, and they can go to be unconscious. And I actually had a couple clients who did a really good job on their horses, but they did that to the baby. They made it, but it was in kind of semi-coma for like about 24 hours. So read the box. It's labeled for 6 months and older. I know some people have done it like at 4 and they've been okay, but don't do it when they're younger, because they can't tolerate it. Okay, and I make a note here, of course I can't spell. The foal and all, you start your worming at 2 months of age, and you worm about probably at least every 2 to 3 months, depending on circumstances. But you treat your horses up till they're about 3-year-olds as young stock. You don't worm them like adult horses. Their immune system, like he said, is not developed enough to fight strongyles, parascaris, or even tapeworms. So keep that in mind. Okay, so we have a lot of different wormers. The thing I like to only remember is they have families. I don't like to memorize the big long chemical names. I don't know why, but what difference does it? So this is one family. It's the Strongyles, and it's paranopamoate. The zoles, when it's got something that sounds like a zole, I consider that the zole family. That's Amphicide and Panacur or Safeguard, as I mentioned. Ivermectin, plus or minus with praziquantel, and moxidectin, which is Quest, and that's plus or minus as well. These are semi-related, but they have little differences. These are semi-related because they're zoles, and this is kind of by itself. This product, Piperazine, has anybody ever heard of that? That's a dewormer they use a lot in dogs and cats now. It's really one of the better ones to kill ascarids, or the little ones, but you got to use so much. The only way you can get it into the horses is to tube them. And so we don't hardly ever do that anymore. And I actually will be embarrassing to tell you that I used it once, and I tried to push it in the baby horse's mouth because I wasn't going to tube it, and they started foaming, and I was like, I'll never do that again. It tastes terrible. So Piperazine I put on here just so if you ever heard it, but it's not routinely used anymore. Okay, so what we need to think about is there's other factors that come into play. First of all, we've got the age, we've got the health of this horse, but we also have, where does the horse live? Okay, we have this donkey who lives kind of in the desert looking area, and then we have this horse and his buddy living right near the creek where it's really nice and moist. Now, would you worm this donkey the same as you would worm this horse? And why? What would be the difference? Why?
Because one of them is really humid and moist with a lot of grass, and the other is dry and without any.
And what do you think the parasites like it dry, or they like it wet and moist and yummy? Okay. So what I'm saying is that when you start making your plans, realize that if your horse lives here and he goes to the bathroom here and water washes the parasites near here. They go there, they graze. Instead of having 100 or 1,000 eggs or larvae in the drops, they'll have hundreds of thousands. So remember that this could be more conducive to a problem. This one, it's not impossible that they could still have parasites, but the likelihood is less. So if you have an adult horse that is a medium shedder, you might be able to get away with only worming him still 2 times a year because he's not going to be exposed. So what I'm telling you, there's a lot of factors that come into play. It's not the old way where you just gave a worm to him every 6 to 8 weeks. So if you lived here in New York in the early spring, or you lived in the early spring in Arizona again, the same idea applies here. It's dry out there, it's cool, it's nice and moist here, just about looks like New York here, right down the road from the golf course. You want to be sure that you realize where you live and where your horses are exposed to parasites and when you make your plan. Same thing on the temperatures. You can live in Arizona and be 83 and nice and sunny. New York, cloudy. Ithaca. In Miami, mostly cloudy. So it's also temperatures. The sunlight will desiccate them somewhat, but not 100%. But the chances of them surviving up here in this area are much higher. So during the time of year, which is what I told you right now, spring, this is when they need to be looked at because the eggs have hatched and the larvae are having a grand time because this is like perfect weather for these guys, except when it snows tomorrow night or when it does. Okay. All right. Can small Strongyles survive in this field, do you think, at all? You're right. Some of the most recent research, I used to tell everybody they couldn't because we were told that the little raincoat didn't protect them as much as they could or they should. But there's been some studies just recently out of Rutgers where the parasite, not maybe quite this extreme, but in a dry area like down in Georgia, they used to think they would all die. They don't. They desiccate. The little raincoat protects them, and then when it rains, they can actually survive. Maybe not at the levels they would survive up here in the great weather, but they're not all dead. So when you think you have a hot summer and you're not going to have any parasites, they can still be around when you have a little rain once in a while. So the other thing that you want to think about is how do you do this? How do you figure out what to do? So this is some general ideas. Stocking density, that means how many horses are in your pasture or in your paddock. If there are really a lot in there, no matter what you do, you may have to handle it differently. If you only have 1 horse on your entire farm and you pick up the manure every day, you're going to be able to deworm him differently than you would if he's in a pasture with 30 other horses. The age, we've already talked about that. Young horses have a whole different attitude as far as how to be wormed. Health status. If you see a horse that looks wormy and you say, oh, you're not due to be dewormed, you don't ever consider that. Health status takes preference. Your veterinarian says he needs to be dewormed. You said, I dewormed him last week. You say, something's wrong. You need to get a fecal. And if the fecal comes out high, no matter the fact that you wormed recently, if it does, he may need to be dewormed. So health status is critical. Now, if the horse has colic, it doesn't always mean that it's due to parasites. But keep in mind, health is important. As I mentioned, dry lots, pastures, you need to know this information. Open and close, what does that mean? Do you let people bring their horses to your pasture and hang out, and then they bring all their resistant worms and expose your horses to it? Or do you buy a new horse and he's been at the sale or somewhere else and you bring him in and he's been somewhere and he lets the resistant worms into your pastures? You have to keep in mind, if you have a closed herd, you never bring anything in, you might deworm differently. But if you bring one in, you're going to have to deworm him a certain way before you let him get out of your pastures. Again, we talked about seasons, the weather, that makes a big difference. What you guys mentioned before about manure handling, that's management. That's absolutely critical. And then the history. If you find that you've been using ivermectin for the last 10 years, it's really important to get your fecal egg count and see if really it's working. It may not be working, but there are cases where it still could be working. Why are you guessing? Why are you thinking? You need to know. And the only way you can is do your fecal egg count. Okay, now what you want to do is that you want to do your fecal egg count usually at least 2 times a year. Maybe with young horses, foals, you want to do it at a different time. You want to do it early spring and early fall. Any reason for this? Anybody know why? Early spring and early fall.
That's when
in
they're
New
hatching.
York.
That's when they're hatching.
That's when they're hatching, and they're also thinking, this is great. This is a great time of year to come out. The parasite's smart. They hatch, they come out of the tissues, and they come through the system, and they get out on the field because that's the chance that they'll be eaten by something, and they'll continue their life cycle. The dumb parasite is one who kills his own host, one that he lives in. If he gets them so sick and they die, he basically was not too smart. The other thing is you want to handle your sample correctly. If you get a fecal sample of feces to give to your veterinarian, it needs to be fresh. You can take one within 12 hours of when it was produced, but if you can get a fresh one and be sure that it's fresh, it's better. You need to put it in a baggie of some sort and get the air out. And if you keep the air out, parasites only hatch when there's oxygen around. So if you have them in a baggie and you squash all the air out, they won't hatch. If they hatch and you try to look under the microscope, you can't find anything. So you want them not to hatch so you can count them. So be sure you handle the sample correctly. If you get one that's frozen out in the barn, it maybe isn't going to give you a good indication. Then you want to review your results with the veterinarian. When I say do fecal A counts early spring and fall, it's hard, I think, when you first start this program, but you should try to do it on every horse on the farm. But I know it can get expensive, so if you can do about 12, if you have 12 horses, or if you have 3 horses, all 3 horses, it would be really good. Because you need to get a general idea. One day it might be a little bit lower, the next day it might be a little bit higher, and the other day it's the same. So you want to get an average and decide whether your horse is a high, low, or low, high, or low, medium, or high shedder. And with that in mind, you can kind of realize that every year your horse will stay most likely to be the same shedder. You want to deworm your adult horses routinely spring and fall. And you want to use a dewormer that kills the intestinal form. You don't have to do the larval form except under certain circumstances, what we'll talk about. Then you need to decide which wormer. Why? Which one will you use? Any ideas? Which would you worm your horses with if you got your results back? Any ideas? Who has baby horses? Anybody got young horses on their farm? No, so we forget that. All right. What I'm getting at is there are certain ways to think about what you want to do. You want to speak to your vet, have your results in front of them so you can actually talk to them about it. I say this, and some people may question it. I don't like to use demoxidexin all the time. It is one of the best. It gets the adults, and it gets the encysted ones that are in the intestine. But if you use it all the time, and this thing's as smart as we think it is, the small Strongyles, it will become resistant. It is also not necessarily, I mean, there are some resistances coming up with some of these in different places, so you need to be very careful about it. You want to use a different product than amoxicillin. And what this fecal egg count is, you should do at least 2 to 3 horses, and really it's recommended to do about 6. Because if you take a horse and do his fecal egg count and then wait 10 to 14 days and do it again, it may not be accurate because you're only doing 2 or 3. Everything has to be an average because we cannot define exactly that the horse has 49 eggs. We know it's on an average, so we can do averages. If you find the fecal egg count reduction is working at a certain percentage and the numbers are in a textbook or somewhere we can tell you, then you know you don't have a resistance. If you find that it's not working, why are you using that product? You're just wasting your time, and you're letting the Strongyles get even more resistant because they are lasting more. They're becoming resistant. So you want to test the horses that have the highest numbers when you do your fecal egg count. So if they're really low and you try to see if it dropped, you're not going to be able to figure that out. 10 to 14 days, that's enough time for the worms, if they get a little shocked because they got dewormed, that they'll start producing eggs again and you can get an idea. It's kind of like surprises them. Okay, then you talk with your vet about your fecal egg count and see if they can tell you which is a worming product that you're having problems with, and maybe you should stay away from it. You can get an idea of the resistance. And this is the formula, not that you have to know, it's fecal egg count before, fecal egg count after times 100, and then divided by the fecal egg count before. But again, that math like that isn't necessary to memorize. Again, we'll bring up the foals. You need to deworm them about every 2 months. And also from 1 to 3, you need to deworm them as a high shedder. And this is really important to do the fecal egg count on the foals, because what if they have the aspirates and you think you're killing them with the dewormer? If you come and look at it, it's got parascaris and it's got Strongyles both. You need to get those astrates out of there. And if you don't know it, you may not be using the right product. Okay, we'll go quickly on pasture management. Say pasture management is a small part of parasite control. Is that true or false? Fact or
That sounds false.
Well, if you take up all this manure and you put it here and let it compost, the chances are the parasite hatching and crawling out isn't going to occur because it's gone, right? So pasture management, if you were meticulous and you got all the manure up and you never let any out there, you would probably be in really good shape. You might be able to worm your horse one time a year. But most horses have some parasites because they've been exposed. They may insist in the body. So you want to go ahead and deworm. But taking up your samples, manure and putting it in compost or carrying it away is really important. With this in mind, what about chain harrowing your pastures? Anybody know? You know what chain harrowing is, most of you? You drag your pastures and break up the manure and spread it all over the place. What do you think? What? Well, what did I tell you about the little dehydration? I was taught the same thing. Chain harrow, break it up, do it on a hot sunny day. Don't do it when it rains, because when it rains then the water will run down and all the little eggs will hatch. It's now thought that chain harrowing just spreads it, because then when it rains, they come back. Yeah, tricky. Anyway, that's the latest information I was able to find. Now this is pretty cool. I can't talk to you about this on a personal basis, but there has been recent information over the years. There's a fungus that you can feed in the feed. It passes through the intestine and it kills the little larvae when they try to hatch out the egg. They've been working on this, I think, since 1992 or something like that. It was I think it was first done in Australia, but nobody in the United States ever worked on it. But just now, I got this notice. This company is in Australia. They're shipping it to distributors here in the United States. So basically what it does, it will kill the larvae of the Strongyles. So you should still clean your pasture probably, but it basically will minimize it. I did look at the cost. I thought it was a little expensive, but I think, thinking about it, maybe in the long run, if you're picking up manure and you're taking a long time to do that, and then you're also deworming, and then you worry about a colic, it might work it out. But you might look it up online. It's actually been proven to be very effective from research, but I've not used it. I just got this like last week, but it may well be a great asset. And you don't have to do it all year long. According to this, it's like the most serious time, which is spring to early fall, when they like it. Okay, now I'm going to go through this quickly so you can have an idea. Okay, if you had a barn with 2 geldings, mature geldings, you had your street stall barn, they didn't have much turnout and you had a little bit of grass, they lived in your 2 pens. What would you do to worm him? What would you do? You guys may have 2 geldings. How would you go about worming this horse? He lives in this paddock. There's no grass hardly at all, just a smidge. What would you do? Some of you guys got to have these horses. Test them.
Test them first, just to get an idea.
Absolutely. Okay. And you do
Probably gonna be a low shedder.
Pardon?
Probably gonna be a low shedder.
You're going to hold? Yes. Okay. He's a low shedder. Okay.
Twice a year.
Okay. Everybody agree? What would you do one time with those 2 dewormings? What would you use? You'd maybe use one product. Which one do you think you might? You're pushing it for me, but yes.
Sorry, that's what my gut.
Yeah, well, I know, but I don't like to use moxidectin, but plus is what I'm trying to get at. In this area, most horses need to have a tapeworm deworming, so the plus is that. You could use pyranopamate, which is stringent. You can use Panicure, but even though there are some resistances developing, if you have wormed on this farm for years of ivermectin, you might go ahead and test. And the way you can figure that out is deworm them and then wait about 10 to 14 days and deworm them again. Take the fecal again and measure it and see if there's a change. It's a small number, it's a little iffy, but it'll give you the ideas. The other thing to remember is that they're not going to contaminate the pasture very much because there's not much grass there and it will be somewhat dry. It won't kill every single one of them, but they're not going to have the same problem as if they were living by the water or they had moisture. So I think there are some questions about people that have these horses in the backyard. Why do I deworm? It says it's a 0. There is some question about that, but what happens, they do feel if you don't deworm that some of these horses that have encysted larvae will come out and they will actually start having problems. So they recommend still deworming as far as twice a year and using praziquantel. Now, I mentioned to you before, okay, you buy a new horse for a friend. What do you do? Here he has this beautiful pasture. He's running around. What do you do on this? How do you deworm him?
I think you should first ask your neighbor if he's been maybe dewormed first.
Very good. How long ago and what he used, right? If he just dewormed him 2 days before he sold him to you because he wants to make sure he was negative and have a good deal because you're his neighbor, that's great. And then you can test him if he did a fecal and compare him. If he didn't, you can still do the next fecal, and if he's negative, then you can kind of say that he was okay. If you deworm this horse, do you turn him out on the pasture before, for how long? Right after you deworm him? What do you do? Keep him in a stall for 2 days, 3 days, a year? What do you do? Well, what the thought is if they're dewormed adequately, they should be able to go out in your pasture because the parasites should be dying. They die and the eggs will pass through. If there's a question, you can put them in a dry lot for a day or so and then put them out in the pasture. But that's just, there's not anything hard and fast that I can find out. Okay, tell me what the most serious parasite is in adult horses. Oh, come on. What's the whole topic been about?
The small Strongyles.
A small Strongyles. That's the one that will crawl out here. And when it rains, it'll wash down the hill. Yes. Okay, I don't think we have time to go over any of these. I know these are more exciting and maybe have questions, but I wanted you to realize that it's really important to actually know about the Strongyles. That's one of my clients' horses. Isn't it cute? It's an Exmoor pony. She bred it. And I thought it was beautiful with all the wild clovers. I hear she was a bad girl. She'd bite and stuff. Anyway, she's like, any questions? Anybody? Yes.
So I have a mini donkey that I got a year ago January from one of my vets at Cornell. And I thought first, not to that makes any difference, but.
Yeah, it does, because we're trying to figure out who it is.
But I got a fecal sample this night. So for like the majority up until like a month ago from one of the workshops here that I came to, he's had kind of like diarrhea or a pad, or cow pad. Like first, I thought that was normal for mini donkeys. I've never had a mini donkey. I didn't know. And I just thought that was normal. And from one workshop, it's not normal.
No.
Every once in a while, he'll have, form little balls. So it's like, I don't know what's wrong with him. I don't know if he's got parasites causing that or what else could be causing that. Because that's his norm.
Mm-hmm. Well, the first thing is to rule out parasites. The second thing, donkeys are pretty hardy, but they may have eaten some sand. There could be some sand that will cause diarrhea. In other words, the sand's in the intestine, it irritates the bowel. Depends on where he was, So if he was grazing and brought the sand. The other thing is there could be just some inflammatory problems that we don't know about, like in donkeys and horses they have an IBD basically. They can have diarrhea. They can have salmonella, which is, a bacteria. It's not something you want, but it can cause the problems intermittently. How old is he? He's got bad teeth?
I think he's 13 or 14 years old.
That's young for a mini donkey. I was going to sometimes bad teeth, they don't chew effectively and they'll actually get a lot more fiber and it irritates the bowel. Some people question that, but I have a horse I've had for 20 years that's had diarrhea for 20 years. The only thing I haven't done is biopsy him, and I'm not going to do that. Now he's old, very old, but I would check the most common, look for the most common, which would be the fecal, which is what he brought?
Yeah.
Okay. That's it.
And there's certainly, I think what Dr. Mittel's getting at is there's quite a few horses out there that you and I have talked to people about that you kind of go through this list of like problems, and then it's just an animal that has kind of loose manure, and it's hard on people, especially in the winter time when their tails are wet and all that sort of stuff. But for the most part, there are quite a few horses out there that have loose.
Yeah.
Donkeys that have loose manure that are normal, but first you should check into these problems.
I would think a donkey, most of the donkeys I have really tight fecal balls because they're desert sometimes, not always desert, but where there's like, it's dry somewhat, even if it's cold, but it's dry. And they tend to conserve their water, so they really should have a nice firm little fecal ball.
Okay.
But that would be one to consider. Anything else? Yes.
I've seen advertised, products that you give on a daily basis, you can eat them daily. What's that story?
That story is that it's Strongyles, which is one of the chemicals. We used to use it all the time, and everybody would get money if the horse got colic because they thought it was really the deal. The way it's recommended to be used now is if you have a horse that's a heavy shedder and it's out in the field that you can't really control it, they'll recommend doing that. And then some people will recommend using it in some young animals, very young animals, to prevent shedding and getting more problems of infection or parasites. I think with the resistance, a lot of people are backing off on it, but it actually has some purpose. But it's used, it's in an alfalfa pellet usually. I mean, in other words, it's not panel, it's tartrate, and it's in the pellet.
For the resistant strains of these parasites, have there been like genetics that they will, these are the changes in their genes that's giving them this resistance?
I think they've got some, Manny can address it, he likes to talk about stuff like that.
Yeah, so each strain acts on a particular gene, and then the frequent exposure, mutation occur on that particular gene. That is
Changes the sequence so that it doesn't work so well anymore.
Yeah.
But maybe you could target a different sequence.
We're going to use we're going to CRISPR and inject a bad one so they die on their own. Yes.
CRISPR for a living, that's why.
See, well, there you go. You got a new plant. No, I agree. I always wonder, but they have them directed towards like the microtubules, and then it's directed to certain chemicals, so they are paralyzed or they're not paralyzed. I didn't tell you that when the baby horse is a worm, the reason we want to use the fenbendazole a lot of the times, the Panacure, is because the worms don't die, and they're not really quickly, they don't die, and they all ball up and they impact the foal. The Panacure lets them worm die a little bit slower, and also it's a different way they die. It's kind of a neurological way that they die, and they end up dying more slowly so that they actually come out and they don't ball up and kill the baby horse. Some of these that are actually more for like the neurological form, they just, and then they all get into a big mass and block up everything. So that's the case. But yes, if you can figure out something to do for this, that'd be one. Yeah.
I've heard that there's a dewormer that you shouldn't use on names. It's true. And I believe there's a use Quest dewormer that you shouldn't.
I probably don't necessarily agree with that because I did have minis and I used Quest, but I think the biggest problem is that I failed, I think, to mention is overworming a miniature on its size. And when you deworm horses, you can get bad results if you don't deworm them at the actual weight. So if you don't take the horse at the right weight, you can actually underworm, and in the miniature, you can overworm with the Quest if you don't actually recommend it, and there could be some problems in that way. But in general, they're pretty safe with it. The problem with miniatures, a lot of people don't worm them quite correctly, and they may have some resistance. And if you use Quest, then a lot of times they might have a little reaction. You get a condition they get when the Strongyles that are encysted, they get to a certain level, and then when they come out, they can actually get what they call cyanthostomiosis, and it's a reaction to the parasites coming out, and they can die. So if you give them a dewormer, something the parasites do, the Strongyles, again, that are smart, the small Strongyles, if they have them encysted in the bowel, where I showed you early on in the bowel, if they're there and there's adult parasites in the intestinal tract, those little ones that are encysted will stay there. They'll stay there and they won't come out, except maybe every once in a while, but they don't come out. But if you deworm the horse and you kill the adults, there's some type of mechanism that this parasite realizes there's no adults and they better come out because they got to protect themselves. So if you deworm a horse that has a heavy load of small Strongyles, and they may actually develop a very serious condition. And if minis have that situation and they do that, they can get really sick and almost die from it. But as far as moxidectin causing problems, I haven't seen that in the miniatures, as far as I know. And I had miniatures for a while, and then I gave them to my admin. And she has them. So Anyway, I don't know anything about that. Yeah,
Yeah, they're overall very safe drugs.
Yeah,
but
most of them.
some like alpacas and stuff.
Yeah.
People have gotten too much, like they have gotten sick from some of them too. So when it's a funny weight and you haven't predicted it right, you get into trouble. So.
yeah, draft horses and miniatures get people in trouble because they underworm. And if you underworm and you do your fecal egg count resistance or reduction test, you think you have resistance and you don't because you didn't deworm them. My horse was smart, but if you didn't get all the hay out of his mouth, he'd hide some and then you deworm it and he'd spit it all over the ground. So basically, I didn't deworm it. So you have to be careful that they actually get what you're giving them and also that they don't spit it out when you turn around. Some of them are smart like that. Yeah. What's your question?
In that life cycle, you showed us, you said that once they're in the horse, they would grow into the intestine for about 2.5 years. And you said the full life cycle would take like only weeks.
I'm sorry, you didn't hear that last part. What was that?
And you said that the life cycle would only take weeks
Mhm.
at the end.
4 to 5 weeks for the life cycle from beginning to the end. The ones that are encysted don't always come out. Sometimes they'll just hang out there. But from the time that the ones that come in to the ones that will actually go in the intestine or come out of here and actually go into the intestine will be about 5 to 6 weeks. But you're right, we're very sharp. Caught that, pretty sharp. You can be a parasitologist if you want to. Dr. Legine will let you come up to his lab and look at stuff if you want. You just ask me, I'll take you up there. Anything else? Oh, Sabine.
Yeah, I want to.
Sometimes we see advertised, and I'm planning to see advertised package deals where you buy your dewormers for the whole year, and there's like one of every kind, and then they all get mixed up, and you're supposed to use one of them every 2 months. So do you want to comment on the usefulness of those kind of package deals?
Well, I used to do that myself. I had a package deal because they didn't want to be bothered, and I would tell them what to do, but that was the old way. Right now, that's not the way to do it. What I would say if I wanted a package deal is I would find out from the owner what the results are and talk to them about their farm, and then I would maybe make a plan that we would do the fecals, and then we would go ahead and provide them with the dewormer if we wanted to pay a package deal. But to have it set up every 2 months that you would use Panacure, you use Strongyles, you use Ecbalin, you use Moxidectin, I think is really wrong. So if anybody, unfortunately, would be doing that, I would ask that you talk to your vet a little bit and hope that they recognize that's not a good idea. It's not personalized for your horse. It really isn't. So I don't think it's a good idea. What are you going to ask me?
Well, I was going to ask the question of, I'm forgetting kind of where, when you're doing your fecal egg count reduction, what is your sort of lowest number that you would use? So would it be, you would only do it in the high shedders that are 500, or would, like if a horse at 100 eggs per gram, and then you're going to recheck and you're hoping for it to be 0? Yeah.
You could, yeah, you got to have at least 500 to be able to tell. And the lowest detection is 25 because then you get down to 0. Yeah.
So there's no point doing
Fecal egg count on a horse
Yeah,
is 100. Right. Yeah. Right.
You know if there's any research being done, we have a greenhouse business, so like we have, over the years, you know, the answer when you had parasites on your plants was to kill them, some kind of chemical. And those parasites have been resistant, so now we're starting to see more things done. For example, you get ladybugs, or you get these little teeny wasps that will go kill these. So I don't know if there any research being done like that, or is that maybe something that may come down?
I am not aware of any. The biggest part of anything like that is that fungus that will kill the larvae.
Right.
That's more or less a natural product that will do it. But as far as something that the horse eats, there's been a lot of questions about using herbal products, but there's been no real studies that show that. I mean, years ago, they talked about giving tobacco juice to horses, and I figured that out. I think Jack might be able to tell about that. Is the nicotine that might have been in it, because nicotine causes a type of a paralysis, high doses of nicotine. So it might have caused the egg.
There were a lot of hopes in some of those things.
Oh, yeah. Yeah, but as far as any real knowledge about that, I don't know. It wouldn't surprise me.
It
that
almost
there'll be
seems
some-
like as parasites become more and more resistant and you run out of what's the next drug you're gonna use,
It's easy.
somewhere in the future, that may be something that.
No, I totally agree. The other thing we need to remember is we don't have to be zero in the horse. I mean, I know we don't want a parasite in us because it's creepy, but they're okay. And actually, if they have a few and they're healthy, they develop antibodies. And then if you take them grazing, then they have antibodies to get the ones they happen to eat. When you take them trail riding, they grab your arm, they start chomping all the hay, your grass. It won't make them sick because they have the antibodies. But as far as anything else, I'm not aware of anything. Do you know anything, Matt? No. He doesn't know because they put him out of business, right?
Does anyone in the research area have any idea why the large Strongyles have never become resistant to all of them? That's really, it's wonderful.
It is. Yeah, and I don't know that there's been no evidence of it that I've been able to find or even any comments about it. Yeah, it's ironic. I don't know. We need to do sequence those and compare those to the other ones. I don't know if it whole genome of the Strongyles, the large and the small.
If you have a horse, like 2 ponies, but one's a little draft pony and one's a little show pony, but they're the same weight, would you deworm them the same or would they be
I would probably deworm them very similarly if they live in the same conditions and they're the same health, like they live together. Horses that live together are often exposed to the same parasites. Like one doesn't get, one and the other one doesn't get it. Generally, they both have them. But again, to answer it is I would do a fecal egg count at least one time and try to figure out what they have and then make your plan. But yeah, I think the ponies would be very similar. I think most all species are very similar. The biggest difference that I know is just the age. I haven't been able to figure out if like the draft horse has any more or anything like that. There has been a little comment that males, stallions, have a higher egg count than females, but other than that,
Wild horse populations, have you seen kinds of issues?
well, not the true wild if they're, because they move, they don't eat their own feces, around their feces. If you had a horse that could move, it would stay away from the piles that it has manure. They call those the roughs. If you've heard that, how when they defecate, there's a pile and there's grass that grows around it. They don't eat, they know better. But in the wild, they don't have the problems that they have because they're contained. But if they were kept together in stocking density, they'd have the same.
and then 3 years later you see a beautiful grass that they haven't touched, you're like, why are they touching that grass?
Exactly.
It's well fertilized and it's growing well.
And they're smart about that. They're very smart about that. But when we confine them, they can't resist. If they only have a room this big, they'll eat all those little pieces. They'll try to stay away. But then when the weather changes and the manure washes away and they don't smell it, they'll sneak over there and eat it, which the parasites are probably still there. But in general, they're smart about staying away from that. They know I don't think it's smell. I think it's just nature that they shouldn't eat where they defecate. Because you've ever seen a stallion, they always go in one area, or they tend to. Those are the ones you like to clean the stalls because they're not all over the place. Anything else? All right. Well, I hope you learned something because it's springtime. So you need to talk to your vet about it. And if there's any questions or anything, we have keychains and little tick things from the diagnostic lab. There's the tick picture that ticks. We have, just quickly, I know it's getting late, but we have the Haemaphysalis longicornis, which has been on the news, which I don't know if you know that tick is a bad tick. And the reason it's bad is that it reproduces without a male, and it produces large numbers. And we do have them in New York, unfortunately. We don't really know where they transmit yet, but if you hear about it on the news, that's what we're talking about. So if you want to see, these are small Strongyles, there's eggs, there's pieces of intestinal you can take out if you're interested, if y'all want to know. Thank you. You're welcome. One way to take one of these if there's enough, because I think this is something the FDA you should understand, so that you know if you want to see.
Okay.
All right, so Dr. Howard and Dr. Anderson will be doing some behavior discussions next month. And
And I believe we're meeting in the hospital or in the DMC.
Yes.
We're in a different spot next month.
LH4.
We're in the vet college, because I think we're doing exams again next month, our poor students. But yeah, so we're not gonna be in this building, we'll be up in the vet.